Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Hi, I'm Pat Loehrer, Director of Global Oncology and Health Equity at Indiana University. I'm here with Dave Johnson, a medical oncologist at the University of Texas Southwestern in Dallas, Texas. This is the second half of our Oncology Etc. conversation with health policy and payment expert, pulmonary physician, epidemiologist, and writer Peter Bach. In part one, we chatted with Dr. Bach about his upbringing, the trajectory of his career from English literature to medicine, and from academia to industry. We also explored his seminal work on drug pricing and improving health equity. Today, we're going to continue our conversation with Dr. Bach by asking him about something deeply personal, his wife, Ruth, who sadly passed away from cancer at the age of 46. Probably about 7 or 8 years ago, you wrote a wonderful article in the New York Times, and there was another article you wrote, but the one that I liked reading was called The Day I Started Lying to Ruth. And this is where cancer stabbed you very personally. Can you tell us a little bit about that and tell us a little bit about your wife, Ruth?
So it was in New York Magazine, just to give credit where it's due. I'm very grateful to them for running it. I wrote that after she died, and it followed on a series I had in the New York Times called The Doctor's Wife, which I wrote while she was getting her initial treatment for breast cancer. And then I walked through the steps of adjuvant therapy that she received in my experience. And then the piece in the New York Magazine talks about her last months, basically, and my experiences then. The story goes that she was tragically taken from us and tragically taken from my son when he was very young. And my experience being at her side, and I think I was a good husband, I was present, was an alarmingly dissociative experience along every dimension. I'd go to her appointment, I would swipe in with my badge. This was my place. And the doctor who took care of her is and was a dear friend. And so were the other doctors in most cases. And the visits, nurses and people in the hall would say hi to me. And then I was going through this absolutely devastating experience, tearing apart the sort of prevailing narrative and experience and structure of my life and our family. And so for whatever reason, it was this out-of-body experience where I could see stuff very, very clearly. Not only clinical realities, like I knew what was happening, but also the mechanics of healthcare, the interactions. And I felt like I should journal it, if you will. And then when I journaled it, I thought I should publish it. And so I wrote about what it was like to stand there when my friend Chip Cody, the surgeon, said, "This is cancer. I can feel axillary lymph nodes. You've got cancer." And what that morning was like between look, most people have a lump. Like, what's the big deal? We'll deal with it. She's young. She just had a mammogram, actually, to that. And then the experience of, and I was in biostat at MSK. So I sat for gazillion protocol reviews. I'd read a gazillion informed consent forms. And then there was one in front of her for a randomized trial for adjuvant therapy. And it was Avastin versus placebo versus a longer period of Avastin, if I remember correctly, an ultimately negative trial I saw at ASCO. But sitting there and actually thinking about what is this like for somebody who doesn't know all of this stuff? And my wife is way smarter than me. That you guys know me. That's the least surprising fact ever. But it was still dizzying for her. And so I wrote about that, what was our conversation like that night after that whole, do you want to join this trial? And her, peppering me with questions, essentially, what the hell's wrong with you guys? Why don't you know these answers? And it was sort of okay, this is why we do randomized trials. This is why we have placebo. And she's smart, not irate. She was much more relaxed and philosophical through the whole thing up until the day she died or a few days before than I ever was. So I wrote about that. Like, what was that conversation like? What was she being asked to do? And how important was it that she did it? And I remember sitting in the room when that trial was presented in the Kaplan-Meier overall survival curves. And I was pretty sure I saw the step in that curve. I'm pretty sure I saw her on that graph. And it made me, obviously, I'm desperately sad that she's gone, but it made me proud that she had contributed to it, even though, negative studies are important too. So I wrote about those things, and I wrote about prognosis and what it was like to have a conversation when she asked about prognosis, and in an article called Waiting for a Magic Number, where I described her oncologist saying, fine, I'll tell you what your chances of living 5 years. You tell me what's the cut point, essentially. Above or below what number are you going to change things in your life? When you tell me that number, I'll tell you whether you're above it or below it. And it was like, wow, philosophy from an oncologist, fantastic, really sunk in with both of us. And that was it. We never asked that question again. He never gave us a number. And I've been greatly rewarded over the years to run into people for here and there who say, I always hand my patients that article to put that in perspective. And then when she died, I wrote about the sheer horror of what was happening to me. And the title wasn't mine, but it was right on point. I found myself in a situation where I didn't want to reveal to her just how bad things were. And it was terribly weak of me. And ultimately, and I describe it in the article, got to a point where I just was ready for it to be over before it was. And I think it's actually not that hard, to be honest, after you've gone through something like this. Like, I don't really care what people think of me. I went through something really hard. And again, I'm someone with resources. I'm someone with knowledge. I could call her oncologist at 2 a.m. and he'd answer. That's not something normal people get. And, even for me, like, this was completely disorienting. And so that article was very rewarding to write because it allowed me to put it somewhere where I've gotten to revisit it. A couple of years ago, of course, he was young when I published it. He said he had read it. He liked the part about the dog. But I got a lot of notes afterwards from strangers saying, that it provided them some comfort that even someone like me went through basically the same experience they went through. And look, this whole even something with me, like me, seems odd, but I think to the external world, somehow we're we get those white coats. Stuff is different for us. And it, of course, isn't at all. Since that time, and we're all in the same world, so we have the same sets of friends. We probably have many of our overlapping friends who we know have lost spouses in recent years. I routinely get phone calls from folks like, I'm going through this. What's the first step? And it's about everything. How do I deal with my kid? Should I go dating? Stuff like that.
Peter, that article should be required reading for every oncology fellow, I think. It was beautifully written, clearly from the heart. I think your undergraduate degree shows in terms of your writing style, but to write that, I'm sure, was emotionally challenging and difficult. In fact, Pat mentioned at the start of our podcast Trillin's book about Alice. In a book review that was written in the New York Times about Alice, Trillin made a comment similar to the one you just made, where people that he didn't even know wrote letters in which they conveyed to him a sense of knowledge of Alice, even though he knew they had never met Alice. And I think your article about your wife conveyed that same sense to anyone who did not meet her. And I think you memorialized her in ways that are really fantastic. But I want to just read something from an article in the New York Times. And this is quoting Trillin. He says, "They may not have known her, but they knew how I felt about her." And he went on to say, "Yes, I got a lot of letters, like the one from a young woman in New York who wrote that she sometimes looked at her boyfriend and thought, but will he love me like Calvin loves Alice?" I think the same could be written about your relationship with Ruth. And thank you for sharing that. I can't imagine how challenging that must be, even all these years later. And I'm glad your son had the opportunity to read that. he should be proud of both his mother and his father.
It was a gift to all of us and mankind. I just, again, as I saw that article, there's a photo of you and Ruth on your last vacation. I think it was from Versailles, and I think you were in the Hall of Mirrors. And I think there's a poignant metaphor there about the reflection of your lives and being with her at that time. And, and we really thank you. We have all experienced this, and it's so powerful there. There's this time when you get a result of a test of someone that you know and love, and there's this limbo between they're so naive and life is good, and it really is a time between heaven and hell in which you're the only one there, in which you know that you're going to go in the room now and change their lives forever by sharing this news. And we've been there and we pause. And again, you talked about that, I think, being in a car looking at the x-ray, and that's the essence of when you said the day you started lying to them, which is understandable because you just don't want to shatter that moment there. We pause and reflect on that enormity of the moment there. And I thank you deeply for sharing that with us, because it's something that we physicians find, and this uniqueness of being a physician and having someone you care about and knowing something that they don't quite know yet. Thank you for all of that.
The important message is that to patients, it's very isolating. And part of what I think the article did, and this was the message I got at least, was send a message to other people that you're not alone, that others are going through it, others have gone through it. And I don't know what it is in that context, but loss. And there's that wonderful article in the New Yorker called The Aquarium, which is by a man who had a sick child. And I don't remember all the details, but the aquarium metaphor is, I can't remember if he's in the aquarium and the rest of the world's outside or the other way around. But it's that isolation that is particularly frightening. And when I talk with my friends who've gone through it, it's part of it is I just say, there's a lot of us out there. I don't know if it gives so much reassurance. 40,000 women die a year of breast cancer. So there's a lot of people out there.
Pat, you had, I think, a final question.
Briefly, now I'm asking to be an academic person there, but if you had a young medical student and you were going to try to give them one lesson about communicating bad news to patients, what would that be?
I've obviously been in this situation many times. I'm a pulmonary and critical care doc, so I've watched bad news be delivered many, many times. And the first mistake I see people make is trying to fill the silence with words. And I think I made earlier reference to it. One of the key skills doctors need to develop is the ability to listen. And sometimes listening to silence is a version of listening, but it's delivering what you have to say without euphemism, with directness. Not everyone's enamored with it. I am, but then giving time to listen, even just space for people to feel safe, that communication is part of a relationship, not a sort of text message, in today's metaphor, right? That just arrives and the person moves on. That is really hard for people to do, not experienced doctors, for trainees, because it's frightening for a lot of reasons. Over my career, I've certainly rehearsed it many times with people. I made the mistake myself too, of just sort of talking over the thing in the room to avoid, just sort of, as you said, the enormity of what you just communicated.
So, Peter, I think you're right on. I think that's one of the most difficult things to do, is to allow that pause to take place. And so many, even highly experienced physicians, attempt to fill that void when it doesn't need to be filled. Been there, done that, been on the receiving end as well as the delivery end of that. It's always challenging. We're out of time, and I'm sad about that because we could go on, I'm sure, for quite a long time. I want to end this by asking you, Peter, we talked about a book on the front end. Both Pat and I love to read, and we share recommendations all the time. I wonder, is there a book or a podcast or anything that you think we should read, or you think our listeners should know about? And by the way, you can include anything that you wrote if you'd like.
Yeah, it'd be very au courant to pitch my own stuff here. I would never do that. I don't know. I like to read as well. And so I just finished Rules of Civility by Amor Towles. Of course, there's a few health events in it, but has nothing to do with anything. But it's a book about New York. I live in New York. So I just enjoyed every single word of it. I'm newly married.
Congratulations.
Thank you. I feel very lucky. And My wife has noted that I often like to read nonfiction at night, typically books about how the world is just going completely to hell. And she's noted that outrage is my happy place, and I sleep extremely well if I read something that's absolutely infuriating. So the other thing I'll recommend is the book about the Department of Justice has essentially lost its mojo when dealing with corporate crime. If your best soporific is being absolutely furious, it's right up there with a full dose of Ambien. So anyway, those are my two recs.
I love it. Yeah, Dave and I both love nonfiction. We love that. So it's great.
We've come to an end of another podcast, and we want to thank our listeners for tuning in. We really appreciate your participation. Remember, Oncology, Etc. is an ASCO educational podcast where we'll talk about virtually anything and everything. So if you have an idea for a topic or a guest you'd like for us to interview, please email us at education@asco.org. Thanks again. Speaking of interesting nonfiction, Pat, if pro and con are opposite, what's the opposite of progress?
I love that Congress.
Yes, Congress. I knew you would get that.
That is a dad joke if I've ever heard one.
We don't have good jokes on this show.
We're going to have to redo the ending to this because, Dave, you said this was an ASCO education podcast. I'm not sure we've taught anybody anything on this one.
Peter's taught us a lot.
That's for sure. Thank you so much, Peter, for a wonderful interview.
Absolutely perfect. Wonderful.
Thanks for the privilege. It's wonderful seeing you both.
Thank you for listening to the ASCO Education Podcast. To stay up to date with the latest episodes, please click subscribe. Let us know what you think by leaving a review. For more information, visit the Comprehensive Education Center at education.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.